Today I want to tell you something more about epigenetics. It's a field that has been known for quite some time, but it has been underestimated as its power. And at MDxHealth and at the university, we are trying to leverage epigenetics as a potential markers for the future and even further as therapeutic agents, actually. So because MDxHealth is a public traded company, I need to start off with this disclaimer. So you all had a good look at that. So basically, our focus is this. If you have a population of a certain amount of people, over time, some people will start to develop cancer. Although this is exaggerated, but it's estimated that at least over a lifetime, 40% of people will develop cancer, or even more, because some cancers go undetected. We will be able to help some of these people. We'll be able to cure them, maybe for some time, maybe for a longer period of time. But these are all questions that we're struggling with right now. We have no clue who will develop cancer. We have no clue who is at a very increased risk of developing cancer. Even right now, with all the technologies, all the biomarkers available, it has already been mentioned, there's hundreds of thousands of papers on biomarkers. We still are not able to officially screen for who has cancer, who does not have cancer. I will come back later to this particular question. For example, for prostate cancer, there's a very famous marker called PSA, but it's a very bad marker, and still there's nothing really in place of PSA that is used instead. Other questions that we can ask is who can we help, who can we cure, and what is the best way to cure these people? We have no way at this point, or maybe we have for some very limited examples, we have an idea about this, but we have no way of telling who should receive which therapy and which therapy is most beneficial, because mainly big pharma, but also it's in our mind that if you have a certain disease, you should receive drug A and only drug A, because that's just the standard way of things. However, in the future, it might be that it's more beneficial to get a very other drug because your genetic or epigenetic profile is adapted to respond to that particular drug. We also have no clue at this point as who is really bad off, who will have a recurrence, who will have a relapse. And these are all questions that you can try and start to answer with biomarkers. So maybe you know some of this, but I always compare epigenetics, and I also always start with the fact of, or by explaining genetics. So basically, genetics is our basic information. It's the hard drive of all our cells, and we can store information on a computer hard drive with bits, zeros, and ones, and we can actually form words with that. For example, this would spell the word epigenetics. Of course, in our DNA, we don't have bits, we don't have zeros and ones, but we have certain molecules called cytosine, adenine, guanine, thymine, and the order of that, just like a computer hard drive, writes certain words in our genome, which we call genes. So for a very long time, especially in the oncology field, all the focus has been in detecting aberrations in this sequence that could actually make you prone to developing cancer. A very famous example was already mentioned before. Angelina Jolie had a mutation of the BRCA1 gene, which made her sensitive to developing breast cancer. Now, what is epigenetics is that, again, the same analogy of that computer, it's how you use the hard drive. We have certain software on our hard drive that we all use, but for example, person A might use very different programs than person C. And this is exactly what epigenetics does. It determines which programs are on and which programs are off for a particular user. So it will determine whether a cell becomes a blood cell or a kidney cell or a colon cell. And so it has a certain tissue specificity. It determines the function of cells. And as I will show later on, it also determines whether you're very prone of developing certain diseases, because it can change over time and it can make wrong decisions over time, and you get a bad profile and you are prone to develop cancer, for example. It has been for a very long time a struggle between genetics and epigenetics, and people believe that you need to look only at one of them. And I'm going to end my talk by saying actually that I believe that you need to have a holistic view. You need to look at multiple technologies at the same time. Maybe for person X it will be something epigenetically lying at the basis, but maybe for person Y it's something genetically lying at the basis. However, it's interesting to see that Time magazine, I think it's back in 2010, had this on the cover saying that DNA is not our destiny. So basically, all of these epigenetic signals that we're were not accounting for before are now recognized, and this is having a strong power. We can actually start interfering with our software, and for example, if the software goes bad, you can try and repair that software again. So this is maybe a complicated slide, maybe not, but so genetics is about the basic DNA, and if you have words spelled wrong, genes with mutations, you actually get a bad protein down here, and the function will be bad. However, epigenetics focus on certain signals that are on the DNA that shuts this entire thing down. So it's not that a bad protein will be produced, but there will be no protein produced whatsoever. So basically what epigenetics does is it has the ability to turn certain genes off and on. It has the ability to dose the amount of protein you will form downstream, or it has the ability to completely, or make the protein completely vanish from the cell. So how does it happen without going into detail? You can add certain, metal groups to the DNA molecule. So on top of the primary DNA sequence, you can add a chemical modifier, and this will determine whether this gene is expressed, whether it's on, whether the protein is formed, whether the protein can have a certain function in the cell or not. So in a sense, our epigenome is a very important part that hasn't been recognized for some part, and actually it goes back to this drawing, and these drawings were actually made to make fun of Lamarck, who had this idea that the giraffe started to grow, their neck started to grow evolutionary because they had to reach for the top leaves there, and that's the reason that they had long necks. Darwin came along and he said, well, that's not the reason, because there's something called or then he came with his evolutionary theory. However, epigenetics is very closely related to that, and actually it's Lamarckism at some point, because we can see that epigenetics is a direct interaction between us and our environment. And these are hereditary traits because we can give certain of these traits to our offspring, and in the direct sense, we can also give these epigenetic marks to our offspring cells. So one cell can give the epigenetic mark to another cell. Now, to illustrate this, the power of it is these are actually identical mice. These are twins. They are genetically completely the same, however, they look very different. So these are called agouti mouse, and this is the normal phenotype. It's an obese mouse. It has it's very prone to developing cancer. So if you would open this mouse, you would see that the colon is, for example, full of polyps. However, if you give it a nutrition that's very high in vitamin B12, which can alter the epigenetic signatures, it will become this mouse. So just by altering the nutrition, you can actually alter how the mouse will look like. And basically so this mouse actually has a gene which makes it very obese, which makes it very prone to having cancer. And by giving certain nutrition to it that's high in epigenetically modifying agents, you will shut down that gene. So this mouse is no longer prone to become obese. So this is really a very powerful tool, although this doesn't work in humans that way, and it's very particular for this specific mouse strain. It is an interesting concept that you can start thinking of altering epigenetic signatures. Now, why are we in this business? Well, basically, first of all, we are focusing on biomarkers and oncology. This is somewhat a complicated slide to illustrate a very simple concept. The green here on top illustrates normal cells, and on the side here are genes, and all the non-green here is cancer cells. And basically what you see is that green means unmethylated and red means methylated. So basically you have very different epigenetic signatures between the normals here and the cancer here. So you see that epigenetic events are very, very common. So for example, for screening and for diagnostic biomarkers, this is an ideal tool because it's so frequent and so common, all of these cells here, you can easily say this is cancer, this is normal. So that's why we're in the field of epigenetics. So now a practical example, how can we actually use this now to improve patients' diagnosis? This is the example of prostate cancer, and in the USA, about 30 million people are screened with a serum marker called PSA for prostate cancer. 1.5 million will have an aberrant result. It's elevated. There is already the first problem. how do you define elevated? Because some say it's 4 nanograms per milliliter, that's bad. Others will say you need to go lower, others will say you need to go higher. So of all of these abnormal results, 1 million people will receive a prostate biopsy per year in the US alone. Of those, only 250,000 people will be diagnosed with prostate cancer. So that means that you have done 750,000 biopsies that showed you that there's no prostate cancer. So maybe we're over biopsying by a lot, but on the other hand, we know that in this pool of 750,000 negative biopsies, we have a 25% false negative biopsy rate. And the reason is very simple. This is the prostate, and a typical biopsy will consist of 12 needles that are poked into the prostate. You will take the tissue from that, and a pathologist will look at it under the microscope saying, okay, these cells look normal, or these cells look like cancer. So if they poke 12 times and your tumor is here, they will miss the tumor. So basically you will say all the tissue looks normal. By doing a prostate biopsy in this standard practice way, you will only sample 1% of the entire prostate gland. So what are we trying to do with epigenetics is actually we're looking at something that's called a field effect. So there's certain molecular changes already ongoing in cells that are precancerous, and although the cells are still looking normal, they are already on the way of becoming cancer. So actually, if this is a tumor right here, you will have molecular changes, epigenetic changes in this entire area surrounding the tumor. So by examining the epigenetic profile in this biopsy, we will say, yes, there's certainly cancer present somewhere near there. So what are we able to do with this test is basically you get, for example, because of an elevated PSA, you have certain risk factors, you get a biopsy. If it's positive, then the decision is clear. You need to get some sort of treatment, or you need to go on active surveillance. If it's negative, however, what typically happens right now is the urologist keeps following you and he says, okay, your PSA is still going up. We're going to go for a repeat biopsy. We don't detect anything. Half year later, you're going back, PSA has raised again, so you're going for another repeat biopsy. So you get repeat biopsy after repeat biopsy. Well, it might very well be necessary. So what we can do with this test is actually profile these negative biopsies and say, okay, your negative biopsies don't have any molecular changes indicative of harboring prostate cancer, so you don't need to go for your repeat biopsy right away. You can easily postpone it for some time. Or on the other hand, if it's positive, you would say, okay, you have molecular changes that are indicative of prostate cancer, so you probably should have another repeat biopsy quite early on so that they can confirm it histopathologically. So this is just comparing epigenetics with other risk factors, and this was just showing that DNA methylation is by far the best predictive factor to say whether you have or whether they will detect prostate cancer upon repeat biopsy. This is also a very interesting example for, it's one of the oldest examples actually of the power of epigenetics. Glioblastoma patients, so that's very aggressive brain cancer, they have only one therapeutic possibility, and that's radiotherapy combined with chemotherapy called alkylating agents. However, what they saw was that these alkylating agents did not work in all of the patients that they were treating. So what they found is that there's a gene called MGMT, which is a normal gene that we all have, and what it does is that it will detect damage to the DNA and it will repair the damage. Now, the interesting fact is that these chemotherapeutic agents like carmustine, they work by inflicting DNA damage. So if you have the active protein, it will see the damage brought on by the chemotherapeutic agent, it will remove it, and so the chemotherapy will have no effect whatsoever. So luckily, there's a subpopulation of about 30 to 40% of the patients that have a methylated, so an epigenetically altered MGMT gene, and so MGMT is not active. The drug can do its work, it can inflict DNA damage. The cells will say, oh, well, there's so much DNA damage here, we need to kill ourselves, and you will see a better response in these people. You will see a shrinking tumor. Now, as I mentioned in the beginning, these things are often seen as very separate, genetics versus epigenetics, while in fact, I do think that the future lies in integrating several levels of information by looking at all of this combined, because for what's good for person X might not be good for person Y. This is actually the colorectal cancer progression model proposed by Bert Vogelstein. And basically he detected genetic mutations at all stages. And based on that, you would be able to identify certain people as potential or patients that could have colorectal cancer. However, not all of the patients harbor KRAS mutations, for example, so you would miss all of those. So what a company called Exact Sciences is doing, they're combining this with epigenetic signals that are also present in these tumors. And they're trying to pick up as many of these stages as they can. So what happens is they have a stool-based test. So basically, stool passes through the colon and it sheds certain cells or takes certain cells with it. So they can check in the stool whether they see, for example, KRAS mutations or whether they see certain epigenetic alterations. And by that, they can screen much better for colorectal cancer that they're doing right now. So, and this is, I'm going to be very brief about this because it's certainly not the main topic, but this is just what I mentioned in the beginning, that right now we can actually start thinking about altering epigenetic signatures in people. We don't have the capabilities yet of doing it in a targeted way. We cannot say gene X has an aberrant epigenetic state, so we need to alter that. We're not at that stage yet, but we can do a full epigenetic wipe. We can wipe out all epigenetic signatures and hope that the cells will do better at the next time they get to place the epigenetic signatures. So what they did here was in lung cancer patients, and those patients received already at least 3 prior therapies, and they failed all of them. After that, they got the epigenetic therapy, so they have a complete wipe of their epigenomes. And the interesting thing is that they were given certain therapies, classical chemotherapies again, after that epigenetic wipe. What you see is that people can respond again to that therapy that they have already failed before. So something that has never been seen before. You can actually use a drug twice in the patient right now, and by that, you can see the power of altering these epigenetic signatures. And the lady in question has been mentioned earlier today already. So I do think, again, that we are moving towards an era where knowledge is power, and that we need to start knowing some of these things about our own bodies, our genomes, our epigenomes. We need to integrate that, and we need to be able to analyze all that data in an efficient way to make useful decisions, not only for the happy few who have all the technologies at their disposal, but actually for, I mean, these technologies can be beneficial for a lot of people. So I do think there's a lot of power in combining things. Thank you very much.